The session is being presented by a team at Burness Communications. First up is Ben Milder, who is the Vice President and the Director of the Public Policy team at Burness. He joined Burness Communications in 1999 and then leads the company's policy initiatives with nonprofit organizations, developing and implementing strategies to advance their clients' ideas in the policy world. His work involves regular contact with Congress, the executive branch, interest groups, professional associations, and think tanks. The policy team supports a wide array of the company's clients, including the Robert Wood Johnson Foundation's Connect project, an effort to help foundation grantees build relationships with members of Congress and other policymakers. Prior to joining Burness, Ben spent 2 years with the Washington, D.C. firm of Preston, Gates, Ellis, and Rivera Seeds, and served as an aide to U.S. Senator Hatfield. He is a Northern California native and holds a bachelor's degree in political science from Willamette University in Salem, Oregon. Elizabeth Wenk is a senior associate for public policy with over 10 years of policy experience, having worked on Capitol Hill and on various congressional campaigns. She joined Burness in September of 2007 and works on both the Robert Wood Johnson Foundation's Childhood Obesity Initiative and the Connect project, as well as on efforts related to building support for health and science research. Before coming to Burness, Elizabeth worked for Congressman Castle of Delaware in many capacities, most recently as Deputy Chief of Staff and Senior Health Policy Advisor. She led his efforts in writing and passing legislation to expand the current federal stem cell policy. Previously, Elizabeth worked for Senator Snowe of Maine as her communications director, and Elizabeth received her bachelor's in communications from the University of Delaware and her master's in political management from the George Washington University. Andrew Peters is the project coordinator for the public policy and joined Burness Communications in July of last year as a project coordinator on the team. He works primarily on the Robert Wood Johnson Foundation's Connect project, and prior to joining Burness, Andrew worked in the Government Relations Department at Carnegie Mellon University, assisting with major events and working on community relations. Additionally, he interned in the press office of Senator Kerry and at the Heinz Endowments in Pittsburgh, PA, where he wrote a feature story for the Foundation's magazine and provided communications support. Andrew graduated from Carnegie Mellon University with a bachelor's degree in ethics, history, and public policy.
Thanks, Heather. This is Ben. We really appreciate this opportunity, and we're looking forward to spending the next 50 or so minutes talking with you about translating research to policy. So in order to make this as helpful as we can, we're really going to rely on you to ask us questions as we go along, which is, like Heather said, why we're not muting your lines, and why we've also built in a few stops along the way where we're going to stop and ask for questions rather than wait till the end and just give you an opportunity then. Now, keep in mind, if we don't get questions, we're likely then to call on you, and you can think of whether we're going to do that alphabetically or reverse alphabetically or randomly, so you can't get off the hook completely. Just quickly, here's our three-part plan for the session today. Part one will be crafting a message. Part two is choosing a path for engaging policymakers, and I'll start with part one. Elizabeth will do part two, and we'll partner, we'll co-lead the final session, which is about getting started. So before I move to part one on messaging, I wanted to cover two quick topics briefly. First, and I know most of you wouldn't be on this call if you weren't interested in exploring this topic, so I'm not going to spend too much time on this, but I think it's worth it to look at what's in it for you. So let's look at three reasons in terms of what's in it for you. The first is the opportunity to inform the policy process and maybe influence it. I think all of you are probably would check that one on your list. The second is that it gives you the freedom to share knowledge with the public through their governments. It's an opportunity for you to have a wide reach to the public through your engagement with government and government's engagement with the public. And I think third, and this might be the most important for all of you, is that the knowledge that what's learned from researchers can genuinely improve quality of life. And I know there are other reasons to do this, but we're sort of identifying these as three that we think you probably all can agree with. So let's look at what's in it for the policymaker. One, new information to inform sound decisions about the best possible policy, and this is where we hold our groans. Two is this outside impartial expertise free of politics, which I think is a really important one for policymakers. And four, that the technical expertise that you provide is likely greater than that which can be found within government. And I think this one in particular, as we talk about different policymaker audiences, this can be different. So, for example, here, what members of Congress and their staff may need in terms of technical expertise might be more than, say, an executive branch or agency official who has more resources at their disposal in terms of the research side of this. So that's quickly those two topics. So one other topic before we jump to this crafting a message first part of our three-part session. And that's just quickly skimming over understanding the rules about engaging with policymakers. So as Heather alluded to, for more than 10 years I've been working with the Robert Wood Johnson Foundation to help them connect their grantees and their work to policymakers. And in that role, I've learned more than I ever would have wanted to know about the rules that govern nonprofit interactions with legislators in particular. So I'm not going to go through that in any detail, but I'm going to give you a very quick snapshot. And like most of you know, the rules for nonprofits and private foundations are different than for corporations and private citizens. Nonprofits are limited in the amount of lobbying they can do, and there's a threshold that I won't describe that relates to a percentage of their operating budget. And then private foundations, with only some narrow exceptions, are completely prohibited from lobbying or using their grant funds to lobby. So the key word there is lobby, and what does that mean? And the easiest answer is that that's a communication with a legislator or a legislator's staff that expresses a view about specific legislation, or it's a request for funding through the legislative process, like an appropriation. So what does this mean for you? The basic message that I want to tell you is that it's good for you to understand what hat you wear when you're communicating with policymakers. If you're 100% funded by a private foundation and you're meeting with a legislator on a foundation's dime, it's important that you're not doing lobbying. If you're representing a nonprofit, make sure you're communicating with the organization so that they can account for your time if you are lobbying. But most importantly, understand that even if you can't specifically lobby, that leaves a ton of room for engagement with policymakers and educating them about your work. And also keep in mind that there's a broad set of policy activities that don't constitute lobbying. And one big example that I think is really important for this group is working with executive branch agencies. So whether that's state or federal on regulatory policy. That does not constitute lobbying. So if we look at a good message is factually accurate but goes beyond the finding. It answered the question of who cares and why. It gave the big picture by providing context, a sense of urgency, and in this case, because the message was much shorter, not necessarily illuminating what the next steps would be. And I think for many, a message is not just about reflecting one study, but it may be a whole body of research. And it's not necessarily time sensitive in the same way a study results might be for publishing purposes, for example. So these are some of the basic tenets of a good message. Let's talk a little bit about delivering your message. And here's where we have a stark contrast between the two video examples that we presented to you. Speak simply and clearly. Certainly, Beth McGlynn did that in her example. This study fundamentally challenges, if not shatters, the assumption that the American healthcare system is the best in the world and that we don't need to change anything. That's a simple and clear explanation of the problem. Obsess about accuracy but let go of precision. This is an incredibly important point, I think, for researchers to keep in mind in particular. The big message that came out of this that was covered through the media widely was, again, that we're not receiving the recommended care we need nearly half the time. but she didn't get bogged down in going into too much detail, providing too much precision about that particular point. She didn't say this was looking at this narrow group, this particular group of people in this geographic area and analyzed in this way and means this with the qualifications of this. She said nearly half the time people don't get the care that's recommended to them. Know your audience, and this is something that we're going to talk about more as we move on in this presentation, but it's critical to understand with a policymaker audience in particular who you're talking to relative to the jurisdiction that they have and the responsibilities that they have as policymakers. I'll use one example. If you're a researcher interested in school nutrition policies, for example, well, you wouldn't necessarily target your efforts at the Department of Education. You'd go to the Department of Agriculture, because that's the place, in fact, that has the jurisdiction over school nutrition policies. A clear desired action, the ask, and this is another topic we'll talk more about, and in this case, with Beth's example was it's time to act. She doesn't specify here, and it's not the forum, but when you're communicating with policymakers in particular, the ask is what they're always waiting for, and it's something you need to be prepared to give them. And it's the reason why you're in that meeting to begin with. So let's shift gears a little bit and talk about an important opportunity for communicating your message, and that's through telling a story. 2 days from today, President Obama will deliver his State of the Union address. Now, if you plan on watching it, I hope you'll play this game. Count how many times that the President looks up to the First Lady's seating area and tells a story about an individual sitting somewhere near the First Lady. And I'm going to come back to this point in a few seconds. So why tell stories? It's how we learn, it's how policymakers learn, and it's particularly how policymakers communicate with the public. So for example, if we look back at this slide, the woman sitting directly behind the First Lady, the President, in this case President Bush, during the 2008 State of the Union address, talks about her individual story as a mother, an HIV-positive mother, who participated in a project funded through the President's Emergency Plan for AIDS Relief, for PEPFAR, and how she delivered a healthy baby as a result, and what she's doing now to counsel other women. That was a story strategically that the President told to build support for the PEPFAR program that he was promoting. A very strategic reason for telling that story, one of probably the 10 or more stories that the President told during that State of the Union address. So do that. Take the time, if you can, to count the individual stories that get told during President Obama's State of the Union, and what was the strategic purpose of those stories. So here are real-world stories in action, and these are both examples of how stories actually drive policy, become a part of the policy. And I'm guessing many of you are familiar with these two examples. The one on the left, that's a picture of Ryan White. And I think, so most of us know the story, but I'll give you the abbreviated version. This was a teenager from Indiana. He became the poster child for HIV and AIDS in the U.S. after he was expelled from his school because he was infected with HIV. He became infected through a contaminated blood treatment, and when he tried to go back to school, parents and teachers rallied against his attendance. He became the poster child for Congress's effort to pass what became the most major piece of AIDS legislation that they would enact, the Ryan White Care Act, which was enacted shortly after his death. The second picture on the right, you can't see the billboard, but it's an Amber Alert. And this was from the story of Amber Hagerman who, in Arlington, Texas, who was kidnapped and killed. And her parents succeeded in getting radio stations to send out missing children alerts. One of them dubbed this the Amber Alert. And then in 2006, more than 20 U.S. senators proposed legislation to create the Amber Alert system at the Justice Department. So two examples of how real stories drive policy, become an integrated part of policy. I tell you this story because when we're working with grantees of the Robert Wood Johnson Foundation, we're working with them on developing stories. After they tell a story, we tell them to use this phrase. I tell you this story because it forces you to create a story that's a strategic story. Again, I keep coming back to storytelling, not for storytelling's sake, but for creating a strategic story to reinforce your message and communicate the request that you're making to a policymaker. This is an advertisement that ran in the Capitol Hill periodical roll call. So this House and Senate members and their staff read this. This was a part of a project that we were involved with, working with Extending the Cure, which was an effort by Robert Wood Johnson and a researcher named Ramanan Lakshmanarian, exploring policy solutions to the problem of antibiotic resistance. So I'm going to stop for a second and have you read this story, and then we'll talk a little bit about it. All right, so I think you get the story. This was Michael Bennett, brought his father into the hospital. He had the flu. They wanted it not to become pneumonia. And he acquired 6 drug-resistant bacterial infections and died. And obviously the point of telling the story, and you can see the bolded section below, the reason I tell you the story because is that bolded section. Unless we do something to address the growing crisis of antibiotic resistance, diseases we could previously fight will once again become untreatable. I just want to break this story down a little bit. Thanks. So, effective storytelling, purposeful, strategic, sincere. And I, again, pay particular attention to the strategic part of the story. Be concise. The story that we told through this ad was 2 paragraphs long. Focus on one person or family. This was Michael Bennett and his father. And make sure that policymakers know that their involvement can make something happen. The whole point of communicating this message through roll call was to encourage policymakers to look at the problem of antibiotic resistance and develop solutions to address the problem. So I know you all have heard lots about, I'm guessing some of you participated in specific sessions on storytelling, but I think the takeaway here is that communicating through a story is often the best means for communicating your message. And that policymakers in particular not only learn as much or more than we do through storytelling, but they also communicate to their constituents, to the public and other stakeholders, through storytelling. So I'm going to stop here and give you an opportunity to ask questions, and I'm going to turn it over to my colleague, Elizabeth. Are there any questions?
I have a question. This is Heather. I was thinking about, you guys have talked about different campaigns that you've worked on, and I know that sometimes people are hesitant to change the way that they do things after they've done them for a long time. And I think also that folks that typically join these web sessions are interested in new ideas, but sometimes taking them back to a group and then having to kind of be the agent of change. So what is something that you would say as a recommendation? How do you convince people that it's okay to start with a story, or that kind of thing? What things have worked for you guys?
That's a good question. I think the easiest way to do that is present the overwhelming amount of evidence that supports the idea that people learn through stories, and that we can spend a lot of time investing in other ways to communicate. But what it comes down to is this is by far the most effective way to do it. I think researchers in particular get caught up with the idea that it's not their individual personal story. They're communicating about the research. But I think what they have to, what's important to keep in mind is that you're doing the research, you're doing the work because it impacts human lives. It impacts people, and at some point the story has to communicate how it impacts people. So if there's just I would say that everyone on this call has an individual story that they could tell, but if they just can't get comfortable with that idea, craft a story that communicates the human impact of your research somehow. If it's not through an individual person you are naming by that individual's name or family, then come up with a way of demonstrating that human impact. It can't be just through the statistics of it. Elizabeth, do you want to add anything?
Yeah, I think from a policymaker's point of view, and I worked on Capitol Hill for about 10 years, and they often, when they pop in for a meeting, only have a very few minutes to spend with a researcher or spend with a constituent. So if you're talking to them about a person that your research is impacting or a situation where your research can help with, especially if it's in their state or district, that is what is going to catch their attention and hold their attention. And that's what they're going to remember to come back to their staff to talk about. They're going to say, hey, remember when Sally came in and talked to us about the problem with the school lunches and what her child was actually eating in the school lunch? They'll remember that, and they're going to want to follow up on that. If it's just statistics and research, while important, if not backed up with the story, it's not going to hold their attention, and they may not remember that in the vast number of other meetings that they're having throughout the day.
All right.
Well, I think if there's no other questions, we'll move on. Again, this is Elizabeth speaking, and we're going to be talking about 3 different ways that we can engage with policymakers. And we're going to be talking about policymakers at all levels, and sort of the tutorial that we'll go through will be applicable to all, but we're talking about members of Congress, state legislators, policymakers at your city council level as well. The first path that we're going to talk about is direct engagement. And you'll see here on the slide, on the left is a researcher that the Robert Wood Johnson Foundation funds named Mary Story. She heads up a national program office called Healthy Eating Research. So she's very focused on school nutrition, access to food, issues of those sorts. And on the right, the woman in the red, that's Senator Amy Klobuchar from Minnesota. Senator Klobuchar is on the Senate Ag Committee, which has jurisdiction over child nutrition programs. And in this form of direct engagement, we brought Mary in to meet with Senator Klobuchar to talk about the results of some research that came out on school wellness policies and walked through the research with her, but mostly with her staff, and really kind of laid out the land of what is happening in schools with regards to physical activity and school nutrition. And the research that Mary was presenting was the nation's largest survey on these issues, so obviously of great importance to the senator that has jurisdiction over these issues. And Mary and the senator and the staff specifically developed such a close relationship, and Mary became a trusted resource to them that when it was time for the senator to hold a hearing in her subcommittee, Mary Story was the top researcher on the panel. And that's a very specific link between presenting the research, developing a relationship, and becoming a trusted resource for the senator, and specifically her staff, who came to call Mary for questions on school nutrition, but also for nutrition and child care programs, food access, just a variety of issues that Mary was knowledgeable about, and became such a trusted resource to them that when it was time to hold the hearing, there was nobody better in their minds than Mary Story to be that researcher. In terms of direct engagement, there's pros and cons, obviously, of each. As you can tell by my description, the pros, obviously, is that Mary had great control over her message, great control over her research findings, and framing those findings the way that were most helpful to her, but also putting them in the context of what was useful to the staff and how the staff would need to present them to their boss, and how the boss, the senator, could use them to communicate with other colleagues. However, it was very time-consuming for Mary, very an involved process in terms of the staff now calling her regularly, which was great, but had to be balanced with all of the other work that she was obviously doing as well. And of course, it required travel from Minnesota to Washington, D.C. on a fairly regular basis. However, now she's a top resource for Senator Klobuchar on these issues. So the payoff is great, but the time intensity is quite high when you're talking about direct engagement. When you're talking about direct engagement with your state legislators, it might not be as much time because you're obviously there and you're very local and you can access them a lot easier. But member of Congress direct engagement, it has a high payoff, but it's very time consuming. The second type of policymaker engagement that we're going to talk about we have here is indirect engagement, or we could call it working through advocacy groups or stakeholder organizations. We're going to walk through this example that you see on your screen right now, and what you see is a one-pager or a fact sheet that was produced by the Campaign for Tobacco-Free Kids. As many of you likely know, the Robert Wood Johnson Foundation has a long history in funding tobacco research, and they fund their research through a national program called Bridging the Gap. The researchers at Bridging the Gap have established a relationship with the Campaign for Tobacco-Free Kids, these sort of the advocacy organization that they want to take the research that these researchers are producing and push evidence-based policies to the policymakers. And what they've done is they've taken the research findings from Bridging the Gap and they've created a series of one-pagers and fact sheets that enable them to push forward, to go to the Hill, to make recommendations on what should be in any type of tobacco-related legislation. Specifically here, these fact sheets were used to push forward with a tobacco regulation bill, a bill that was sponsored by Senator Kennedy and Representative Waxman and was signed into law by President Obama last summer. And in the opening of President Obama's speech, he thanked the Campaign for Tobacco-Free Kids as leading advocates for this bill, and he also actually cited a few quotes and statistics that the Bridging the Gap researchers contributed to. And this is a nice relationship that shows how researchers, which as Ben walked us through, are not allowed to spend their money lobbying, but how they can work directly with advocacy organizations who can and feed them the correct research, the correct stats, facts, etc., so the advocates can then make the policy arguments to the members of Congress. So it's a very direct link while keeping the lobbying lines nice and clear of how advocates can work with researchers to advance a policy cause. There's, again, of course, pros and cons of indirect engagement. The pro, clearly, it has wider reach. These advocacy organizations they know Capitol Hill, they know how to access Capitol Hill, they know the staff, they can get the information out very quickly, and it's less time on behalf of the researcher, of course, but you have less control over your message. You're not the one that's going to be doing the direct communication, so the advocacy organization always will have a filter. They will take your research and frame it the way they want to frame it to make the case. So it's critically important to make sure you are comfortable with the advocacy organization that you're working with or the stakeholder group that you're working with to make sure your research is presented in a factually correct way and it's framed in the way that you would want it to be framed as well. So that's the second type of policymaker engagement. And the third type of engagement is engagement through the media. And we'll use another example here. In this case, the first, under the New York Times headline, you'll see doctors urge end to corporate ties. And in this story, they're talking about an organization called the Institute for Medicine as a Profession. And basically, their main goal is to advocate that against the influence of large pharmaceutical companies such as Merck and Eli Lilly over medical groups like the American Medical Association. And their concerns are regarding payments and gifts and honoraria and travel, et cetera, that are going to physicians, sort of as a kickback, if you will. And this caught the eye of Senator Grassley and Senator Cole and started having a series of hearings on this practice and have introduced a bill called the Physician Payment Sunshine Act. And the issue was picked up right out of the media, right out of this, this story that was printed in the New York Times, and got the policymakers so engaged that they actually held hearings, brought folks in, and moved forward with the bill. There's obviously pros and cons, if any of you have worked with the media, of engaging with the media. Massive reach. The New York Times, obviously, millions of people across the United States and the world read it either in paper or online, so it's reaching many households throughout the United States, including policymakers, probably one of the top publications they read, along with the Washington Post, Wall Street Journal, and sort of Capitol Hill publications. But the con is, as many of you may know, that you have no control. The one thing you have control over is the interview with the reporter, but you have no control over how the reporter actually presents your information or what the story is that they end up writing. And you don't have any control on how the policymakers are going to actually interpret that information. So there's definite pros and cons to working with the media. And as you think about each of these ways and how you may engage in the policymaking process, I think it's important to not silo any of these, but to think, and they're not mutually exclusive, but to think how you can use one maybe avenue of engagement and build on another avenue of engagement. So just a few examples in terms of how do you choose which path. If you have a very narrow research issue and no advocacy group exists, like in the example of Campaign for Tobacco-Free Kids, obviously there's a lot of advocacy groups that are focused on tobacco, American Lung, Cancer Society, Campaign for Tobacco-Free Kids, etc. So they are ready-made for this type of advocacy. But perhaps what you're working on does not have sort of a large advocacy group like this. It's a very narrow issue, and you know that it's just not going to be sexy for the media. Then probably the first thing that you want to do is directly engage with your policymakers or their staffs, quite frankly, because in many instances, if the policymaker does not have time, the staff is just as good, if not a better stand-in for that member of Congress, because the staff is really, really focused and really knowledgeable about your specific issues. So that's what I would recommend if you have a very narrow research issue. If you are working on a study and you know it's going to be a blockbuster study, like this Beth McGlynn example that Ben used, then a media strategy is absolutely the way to go. But you would want to follow that up with a direct engagement strategy as well, with meeting with your member of Congress, but also if it's that big of a study, with meeting with members of Congress or the staff that are on the committees that look at these types of issues, even if you're not from their state. If you simply want to play the game, but you know you're completely strapped for time, but your issues do fit in to some of the advocacy organizations' issues, then I would definitely recommend, hooking up with one of those advocacy organizations, establishing that relationship, giving them a heads up on the type of research that you've got in your pipeline and how the results of your research might help inform their strategy and their policy platform as well. So again, not to be viewed as mutually exclusive, but while your research is happening, you should immediately start thinking about how am I going to communicate this to policymakers, what avenue am I going to take, and even be thinking of, as the research is coming out, how you're going to prep those results to target those specific ways of engagement as well. So that's it in terms of talking through the three types of engagement with policymakers.
Thanks, Elizabeth. So let's move into the third part of our three-part plan, and this is in really response to the survey that you all completed in advance of this session, and responding to what a lot of you wanted was sort of where do we start, how do we get started in this process. So we want to talk a little bit about what we're calling the 4 no's. So the 4 no's are know your audience, know the calendar and look for opportunities, know what to bring, and know the anatomy of a meeting. So know your audience, and this is really important, obviously, but it starts with identifying and understanding, what policymaker audience you want to reach out to. I mentioned the earlier example of understanding that if it's school nutrition is your issue, that it's the Department of Agriculture, not the Department of Education, where you want to focus your attention. If your problem requires a change of law, you're starting with the legislature before another policymaker audience. Just a quick story. Last week we had a speaker in our office from the CDC, from the Washington office of the CDC. And I thought 2 of the takeaways from that conversation were relevant for our discussion here today. And one was that he made the point that we were all thinking about the day after we had a new senator from Massachusetts, that if health reform passes, all of the action turns from the legislature to the executive branch agencies who have to implement this 2,000-page outline. But, given circumstances, he also made the point that if health reform doesn't happen now, still much of the action is likely to take place at the agency level. Point being that if the president is facing a more and more uncooperative legislature, the Congress, going into an election year, he's going to focus his attention on what can be done on the regulatory side to advance his agenda. So I thought it's an important takeaway to remember, given the current environment that we're in. But the other takeaway was for me was a story he related to us about CDC's efforts to work with the Center on Medicaid and Medicare Studies, with CMS, on tobacco policy. They'd been trying over and over again to appeal to CMS about tobacco, making the public health argument and arguing the moral grounds for action by CMS in concert with what CDC was doing, but having no success. And it was only after they took the time to learn about the CMS regulatory process and that they developed a plan that reflected CMS's arguments and made the arguments for them that they were finally successful. And his lesson was, you got to build the case from your audience's point of view. And the message here is the only way to do that is by understanding your audience. On this slide are a bunch of different resources that we were going to run through a couple of examples, but I'm just going to point them out and encourage you to take the time, even if it's 10 minutes here or 10 minutes there, to explore some of these sites. USA.gov, for example, is a great portal into all types of government information, whether it be federal, state, local, whether it be executive branch or the legislative branch of government. If you go up on their main web page, on the right side, they've got a federal, state, local tab, and you can get to all sorts of resources about government from that spot. The other website I'd point out is this regulations.gov website, which provides all sorts of information on the regulatory rulemaking process and gives you an opportunity to set up searches tracking what rulemaking is currently happening that might be of interest to you. And then some of these other resources are pointing you to particular places and particular policy audiences that you might find useful. So here's the part where we need at least one answer from one of you, hopefully more. We've got 5 people up here. Can any of you name any of these people? And if you want to chat, type it in. You'll still get the points.
I know Mary Wakefield and Kathleen Sebelius. Is that her name?
Sebelius, right. And why might they be of interest to you?
Health and Human Services and the other health department.
Resources Services Administration, right. HRSA, absolutely. With all sorts of jurisdiction over community health centers, and Kathleen Sebelius, obviously, as the Secretary of HHS. Thank you. You get special points for sure.
Thank you.
Any other volunteers?
Judith Myers via chat says that Olympia Snow, Republican from Maine, has been supportive of health reform.
Right. Absolutely. Olympia Snow, key player in the Senate health reform debate. As it turned out, voted against it, but in conversations now, they're talking about, can we create a scaled-back version of the bill that could get people like Olympia Snow's debate, and they could be the vote that pushes health reform through in the Senate, this next version. The person on the far left is Senator Tom Harkin, who's the chair of the Primary Health Committee in the Senate, the Health, Education, Labor, and Pensions Committee. And the person on the far right is Congressman Boehner, who is the minority leader in the House of Representatives and obviously has a lot of influence in what the Republicans are doing in the House of Representatives. So again, thank you for participating in our little exercise there.
Thank you also to Lynn Garner and Chris Breeze for getting the answers correct as well.
So real quickly, because we've only got a couple minutes left, knowing the calendar, understand if you're working with the state legislature, for example, when the legislature is in session. Understand sort of the rudimentary timing of the policy process. When does the budget get presented? The president's going to release his budget on February 1st, for example. Don't feel like this means you need to know everything, but know the very basics is going to be helpful in terms of getting started. Know what stuff to bring. Elizabeth used an example earlier of the fact sheet that the Center for the Campaign for Tobacco-Free Kids used. This is an example of a one-pager from the Greenhouse Project supported by the Robert Wood Johnson Foundation. Keep in mind that 200-page reports are going to be hard for certain policymaker audiences to digest in particular, and that one thing we recommend that each and every person who's going up to engage with any policymaker audience at any level is create a one-pager. It's going to force you into the process. It's the discipline of the process of getting down on one page, not in minute font, although that looks sort of like what this looks like on this slide, and present your contact information, how they can reach you, and make sure that you're capturing your message in the body of that document. Don't flood it with statistics, but use a couple of key statistics. One other point related to this, sometimes you need to create a policy-specific document that might be an executive summary or a policy brief from a larger report. And finally, know the anatomy of a meeting. And this is, we put this sort of unwieldy slide here because we wanted to point you to a resource that we're going to provide you with, which is the Connect Resource Manual. It's a document that we give to grantees of the Robert Wood Johnson Foundation who are participating in this project that we work on that walks through a lot of the basics of engaging with policymakers. And the anatomy of a meeting here captures it just gives you a basic structure for you to be comfortable with as you walk into a meeting with any policymaker. It's walking you through describing who you are and what you do, telling a story to illustrate your work, talking a lot more about the ask, and whether you're advancing a specific lobbying ask that might be, and you can do that obviously, or whether you can't and you need to find another way to engage policymakers. So this is, we encourage you we weren't able to post this on the site, but we encourage you to take a look at this resource, and you can request this by emailing Heather. So last point, and maybe you can take one or two questions here, but think big, start small, start now. And I think this process can sound very complicating and a little bit intimidating, but I think the point is, for those who have not done it, you can do something tomorrow. You can get this process started. You could schedule a meeting with a local state legislator or other local policymaker. You could find a mentor somewhere within your institution who has a ton of experience and buy them lunch and hear from them about how they've gone through this process. You can contact one of these stakeholder organizations that Elizabeth talked about and talk to them about the work you're doing and see if there's any intersection for you going forward. So we really hope that the takeaway here is that you'll be encouraged to do something versus not do something, and that hopefully will give you some additional resources that can be helpful for you in that process. So we are right at the hour, but we're happy to take a few questions via the chat or via phone if you have them.
Well, first, before we get to that, I just want to thank you guys for such a wonderful presentation. I just think that this is such a wonderful topic and of importance to everyone in this field. So I really want to thank you for that. And also, I realized that I was neglectful in not introducing all of you to Lynn Garner from the Donaghue Foundation, who is on the line with us today. And as I mentioned at the beginning of the call, the series and the Funders Forum that preceded it was a joint effort between INQRI and Donaghue, and Lynn was, of course, key in that effort and just an amazing person to work with. So I just wanted to acknowledge that she's on the call and welcome her. Late, sorry. But I did want to make sure everyone knew that both organizations were represented here today. And with that, I'll turn it back over to see if any of you have any questions.
I have a question. Hi, it is Lynn, and thanks, Heather. We're really happy to be able to do that. The question I have is, if you have an interest, something at the federal level, does it make sense to first go to a representative or a senator from your state of whom you're a constituent, even though they may not have jurisdiction in the area, or should you just kind of forget about that and go to the representative that has jurisdiction in the area you're interested in?
That's a great question. And I think if we had more time, this would be an issue that we really would have mined into more deeply. It absolutely makes the most sense to start with your individual legislator. You know, politics is local. Politics is about relationship building. The place that you have a voice that's ready to hear from you is your member, is your delegation. They're open to hearing from you. they're going to be willing to schedule a meeting. They also can be strong advocates on your behalf with the member who might be the one who has the influence on the particular issue. So it's much easier to get in through that, call that the side door versus the front door if you're going at, if you're trying to get to a particular member who might have the influence around that issue. But it's a great question. Well, we want to thank you again for taking the time to participate today. We hope that it was interesting and engaging and worth the time, and we're sorry that we weren't able to make it a little bit more interactive, but we appreciate you taking the time.